Question 1. A 65-year-old woman presents with progressive memory loss, personality changes, and difficulty performing daily activities over the past 2 years. MRI shows diffuse cortical atrophy, most prominent in the hippocampus. What is the most likely diagnosis? The most likely diagnosis is C. Alzheimer's disease. Progressive memory loss over several years is the defining feature of Alzheimer's disease. As the condition advances, patients commonly develop personality changes and increasing difficulty with everyday activities. Neuroimaging typically reveals diffuse cortical atrophy, most prominently affecting the hippocampus, a structure essential for memory formation, making this finding classic and highly suggestive of Alzheimer's disease. Question 2. A 45-year-old woman presents with severe headache, photophobia, and neck stiffness. CSF analysis shows elevated opening pressure, lymphocytic pleocytosis, low glucose, and high protein. India ink stain is positive. Which is the most appropriate treatment? The most appropriate treatment is C. Amphotericin B plus flucytosine. The patient's symptoms, severe headache, photophobia, and neck stiffness, are consistent with meningitis. Cerebrospinal fluid findings of elevated opening pressure, lymphocytic predominance, low glucose, and high protein strongly suggest a fungal etiology. A positive India ink stain is characteristic of Cryptococcus neoformans, an encapsulated yeast that commonly causes meningitis, especially in immunocompromised individuals. The most appropriate treatment is amphotericin B plus flucytosine. Question 3. A patient with long-standing diabetes presents with burning pain in both feet, worse at night. Examination reveals reduced pinprick sensation with preserved vibration sense. Which nerve fibers are primarily affected? The correct answer is D. C fibers. The patient presents with diabetic neuropathy, characterized by burning pain, especially at night in a stocking distribution. On examination, there is reduced pinprick sensation, while vibration sense is preserved. This pattern indicates involvement of small peripheral nerve fibers rather than large fibers. C fibers are small, unmyelinated fibers transmitting burning pain and temperature, which are primarily affected in diabetic small fiber neuropathy. Question 4. A 55-year-old man develops progressive memory loss, personality changes, and visual hallucinations over 6 months. MRI shows cortical ribboning. EEG reveals periodic sharp wave complexes. What is the most likely diagnosis? The correct answer is D. Creutzfeldt-Jakob disease. The patient exhibits rapidly progressive dementia over months, accompanied by personality changes and visual hallucinations. MRI shows cortical ribboning, hyperintensity in cortical gray matter, and EEG demonstrates periodic sharp wave complexes, findings characteristic of Creutzfeldt-Jakob disease. It is distinguished by its rapid course, often with myoclonus, and distinctive imaging and EEG patterns. Question 5. A 32-year-old woman presents with diplopia, ptosis, and difficulty chewing that worsens throughout the day. Repetitive nerve stimulation shows a decremental response. Which of the following antibodies is most likely present? The right choice is B. Anti-musk antibodies. The patient is a young woman with fatigable ocular and bulbar weakness, ptosis, diplopia, and difficulty chewing, along with a decremental response on repetitive nerve stimulation, confirming myasthenia gravis. In this context, anti-musk antibodies are most commonly associated with bulbar-predominant myasthenia gravis in young women. Question 6. A 70-year-old woman is brought to the emergency department 90 minutes after sudden onset of right-sided weakness and slurred speech. She has a history of atrial fibrillation and hypertension. Blood pressure is 160 over 90 millimeters of mercury. CT scan of the head shows no evidence of hemorrhage. Which of the following is the next best step in management? The most appropriate answer is C. Intravenous alteplase. The patient's presentation of sudden onset right-sided weakness and slurred speech is classic for an acute ischemic stroke. Symptom onset occurred 90 minutes ago, placing the patient well within the 4.5-hour therapeutic window for thrombolysis. Additional supporting factors include a history of atrial fibrillation, a major risk factor for cardioembolic stroke, acceptable blood pressure, below 185 over 110 millimeters of mercury, and a non-contrast CT showing no intracranial hemorrhage, which is essential before thrombolytic therapy. Question 7. A 7-year-old girl has frequent brief episodes of staring and eye rolling lasting a few seconds. Her teacher reports declining school performance. Development and neurologic exam are normal. EEG during hyperventilation shows generalized 3 Hz spike in wave discharges, and first-line treatment is started. Which comorbidity is she most at risk for? The correct answer is A. Attention deficit hyperactivity disorder. The child's presentation is consistent with absence seizures, characterized by brief staring spells, a normal neurological examination, and a 3 Hz spike in wave pattern on EEG. Children with absence epilepsy frequently experience attention and learning difficulties, making attention deficit hyperactivity disorder the most common comorbidity associated with this seizure type. If you enjoyed this quiz, please like the video, share it with friends, and subscribe to the channel for more.